Hello, and thanks for purchasing Hugga. Please watch this short video to learn how to apply the Hugga Sleep System. Fitting the sheet. Place the sheet onto the mattress, making sure the corners are all well tucked in under the mattress. To accommodate all types of mattresses, including air alternating, we use a toggle and cord to tighten the sheet depending on the needs of the client. Use the toggles located on both sides of the bed. Lying in supine. When transferring the patient onto the bed, please make sure they are central in the bed and as close to the headboard as is comfortable. Head support. Place the head support under as shown on screen. Please note that the patient may need assistance. By supporting the head and neck, your client's shoulders should be free to extend to the optimum position on the bed. Achieving midline. The fundamentals of good positioning comes from the pelvis. By correcting the pelvis to a neutral position, the rest of the body has more chance to gain symmetry. Fit the pelvic pads to the sheet, as in the video, to maintain this position. Thorax support. To support the trunk, please place the thorax support firmly next to the patient's trunk as shown. Supporting legs and lower limbs. The blocker. Supporting the lower limbs is crucial. This is achieved by using our specially designed blocker shape. As no two legs ever present the same, it is important to support the legs independently of each other. If the patient can lift their own legs high enough to place the blocker under each leg, then please encourage them to do so. Alternatively, please assist the patient to lift their leg whilst employing the correct manual handling procedure. Placing the block supports into position may require the assistance of another person whilst you support the leg off the bed. Once the blocker support is in place, secure the Velcro strap as shown. This may prevent excessive flexion of the lower limb after a cough or a spasm. It can also encourage correction when your client is adducting or abducting. If you are using the blockers of legs, you will no longer need to use the leg adjustment function if your client has a profiling bed. Please repeat the process on the other leg as shown. Supporting the feet. Double edge wedge. The feet are supported by a double edge wedge. The support discourages the feet from falling into a pointed position and they provide a gentle stretch on the calf muscles. The double edge wedge is specifically designed to offer two different angles which provide a greater or lesser stretch on the calf muscles. Remember as well that supporting feet should limit your client sliding down the bed, and feedback from the cushions should also aid the swallowing function where appropriate. Fully supported. The patient is now fully supported using the Hugga. The most optimal position of symmetry has been achieved. If your client needs to lie at 45 degrees, then please raise them after you have fitted the system on a flat bed. Side lying. When transferring the patient onto the bed, please make sure they are positioned as close to the center of the bed as possible so that you can place the Hugga cushions either side of the body. Head support. To ensure comfort for the patient at all times, place the head support under the patient. They may need assistance with this. Again, we are trying to support the head and neck only, allowing the shoulder to be in direct contact with the bed. The cushion is also designed to provide a point of reference for those clients that tend to pull their heads back in side lying. Supporting the back. Double edge wedge. With the patient on their side, place one of the double edge wedges firmly behind the patient's pelvis. Now that's in position, take the second double edge wedge and place firmly at the patient's back, in line with the other wedge. Now assist the patient to roll back onto the supports. The aim is to achieve neutral spinal alignment where possible. Please note to pull the shoulder in contact with the bed slightly forwards to relieve pressure. Anterior support. Thorax support. For extra comfort and support, place one of the thorax supports in front of the patient at their stomach to chest area. This will also act as a cushion for the patient to cradle, allowing them to feel safer in bed. Supporting the lower limbs is achieved with two specially designed bridge supports. As their name suggests, they will help to aid and separate the legs whilst employing much needed support. If the patient can lift their own legs high enough to place a bridge under each leg, then please encourage them to do so. Alternatively, please assist the patient to lift their leg whilst employing the correct manual handling procedure. Once the bridge supports are in place, secure with the Velcro straps as shown. The straps are there to support and maintain the optimal position. You will notice that your client should now have airflow between their legs. The top hip is neutral and the knee and foot are well supported. For further information, please visit our website or contact the office. Our team are always here to help if you would like extra training for your Hugga Sleep System. We are committed to achieving the best possible posture for your client.